In mid-September, it was reported that since the beginning of 2020, wildfires in California had raged and burned over 3.2 million acres of land. That's almost the size of Connecticut. 24 people had died and 4,200 structures destroyed, no doubt amounting to billions of dollars in damages. Fires continued to ravage California along with our northern Pacific states. Almost a month later, it's very likely that those numbers continue to rise. These wildfires contain another hidden danger though. The extreme heat waves that follow wildfires, along with the wildfires themselves, have together disproportionately affected low-income households in the state. A third of all households in California are located in a region called the Wildland-Urban Interface, or WUI. This is where human development and environment meet. The WUI contains roughly 140,000 units of subsidized housing. While there is a lot of affluence in this area, there is plenty of poverty as well. These areas, due to their location and lack of funding, are left with few options to address the extreme heat. Issues like lack of trees in the community, which provide a canopy cover, better insulated housing, access to parks, and the financial ability to afford cooling leaves these communities at a disadvantage. Although these areas that suffer extreme heat make up only 8% of the state's housing, they make up 16% of all public housing units. Research has shown residents of low income tend to have higher incidence of chronic health risks that can be made worse by extreme heat, which then creates a potential strain on the health system. And California is not alone. Across the country, in many cities, lower income neighborhoods tend to see this dangerous overlap of extreme temperatures and high incidence of chronic disease. Where these communities are located raise concerns over equity, safety, and resilience, especially during extreme events. Urban planner and professor of urban studies at Santa Clara University, C.J. Gabe, says that we know that these households tend to have little or no savings. Their inability to bounce back really justifies some kind of policy response. What's up, everybody? I'm Will, and this is The People's Health. In this episode, we're going to talk about affordable housing, starting off with the history of affordable housing as a wealth building tool, as well as the systemic inequality associated with that history, the disparities that exist in housing, and how that leads to poor health in communities, and perhaps a happy ending as we look towards the future. Glad to have you back. Let's get into it. We're told that two of the most effective tools for building wealth and obtaining financial well-being in America are home ownership or obtaining high-quality, affordable rental housing. Throughout our history, lawmakers look to secure new land for it, reduce significant barriers to it, and ultimately increase the capacity to build wealth through it. Unfortunately, these efforts have shown time and time again to almost exclusively benefit white households. We've seen these policies go as far as removing black people from their homes, deny them access to wealth-building opportunities, and then relocate them to isolated communities. For centuries, structural racism in the United States has contributed to vast racial disparities in wealth and financial well-being. Research suggests that disparities are so entrenched in our society. If current trends continue, it can take up to 200 years for the average black family to build up the same amount of wealth as its white counterparts. Let's take a look at how government-sponsored displacement, exclusion, and segregation have contributed to racial inequalities in America by taking a dive into the people's history. In 1845, popular editor and columnist John S. Sullivan wrote in a magazine, "Our manifest destiny, to overspread the continent allotted by Providence for the free development of our yearly multiplying millions." From that moment, the sentiment of manifest destiny was enshrined forever. A belief that white settlement and expansion throughout North America was not only inevitable, but ordained by God. That belief wasn't born in 1845 though. Long before that article was written, this ideology was used as justification for ethnic cleansing and massive systemic displacement. With policies like the Indian Removal Act in 1830, where under federal law, thousands of indigenous peoples were forcibly removed from their lands in order to make room for white settlement. Then in the following 2 decades, thousands of indigenous peoples died as they were marched westward in what became known as the Trail of Tears. Then later, with the Dawes Act in 1887, forced indigenous tribes to assimilate by seizing their lands and later returning them by way of small parcels to each head of the families belonging to the tribe. Any land left in surplus could then be bought by non-indigenous peoples. This amounted to 2/3 of indigenous lands redistributed to white Americans. To put a number to it, 90 million acres of valuable land was seized with this act. In the mid-20th century, displacement policies against indigenous peoples continued as over 100 tribal nations lost their federal recognition and fell under state jurisdiction, contributing to further loss of millions of acres of land. In 2017, research showed that almost 1 in 5 or 22% of indigenous peoples lived in poverty, compared to just 8% of white Americans, less likely to own homes than their counterparts, and if they did, they were more likely to have less value. While indigenous communities were the primary target of these government-sponsored displacement policies, other communities of color, especially the Black community, experienced them and continue to experience some of these policies as well. For Black communities, public policies that ended up in displacement were often created under the notion of creating new public spaces, combating urban blight, which we're going to get into in future episodes, or attempts to bolster economic development. Examples can be seen throughout the country. New York City, 1850s. Lawmakers used eminent domain to destroy a thriving, predominantly Black community in Manhattan, displacing thousands of residents to create Central Park. San Antonio, 1960s. Lawmakers used the same eminent domain tactics, touting the same excuses to displace 1,600 mainly Latinx and Black residents and destroy over 1,300 buildings to construct what we know today as Hemisphere Park. Atlanta, 1990. Lawmakers demolished what was then the oldest federally subsidized affordable housing project, which displaced upwards of 30,000 mostly Black families to create Centennial Olympic Park. Just a few examples of policies that have displaced ethnic and racial minorities in our history. Sometimes federal, sometimes local, but always devastating to our communities of color. The construction of highways also contributed to the displacement of these communities, as they were built mostly through communities of color, for the sake of mostly white communities' access to job opportunities in urban centers, as a result of something called white flight. Later, and what we are seeing today, is the relocation of mostly white middle class and above to the city, as they flee from growing congestion on roadways. This has led to the phenomenon too intricate to get into in this episode, so we'll just save it for later. We in this nation have touted for some time the importance of property ownership, affordable housing, and economic development, but at the same time have seen how this has coincided with the systemic removal of people of color from their homes and their communities. These practices have made worse racial disparities and economic indicators of well-being, but it has had the added effect on health and general well-being communities of color as well. Research has been pointing to for some time to the impact that housing has on health, and perhaps now is a good time for it to be taken up by lawmakers. Of the 4 determinants of health mentioned in episode 1, housing is perhaps the best researched. That research has led to 4 different pathways in which housing impacts health. In this episode, we're only going to dive into one, but here's all 4. Each one of these affect the other, with the first one being the health impact of having a stable home, the stability pathway. Second, the health impact of conditions inside the home, the safety and quality pathway. Third, health impacts of financial burdens resulting from high-cost housing, the affordability pathway. And of course, number 4, the health impact of neighborhoods, to include both the environment and the social characteristic of where people live, the neighborhood pathway. In this episode, we're only going to focus on the affordability pathway. A few years ago in 2015, 38.9 million American households paid more than 30% of their income on housing, earning them the label of cost burden. That same study also found that 18.8 million American households were severely cost burdened, meaning that they spent more than 50% of their income on housing, about 11 million of those being renters. Now this is scary, because if both rents and incomes continue to rise at the rate of inflation, by 2025, the number of renters considered severely cost burdened is expected to reach 13.1 million, an increase of 11%. Lack of affordable housing puts American families in a very difficult situation. Having to decide between paying rent and essential expenses makes these families more than likely to postpone needed medical treatment or go long periods with an insufficient supply of food. This then can affect the education or the mental well-being of adults or children living in their household. While home ownership and affordable rental housing are not the end-all be-all solutions to problems of structural inequality, what it can be is a step in the right direction. It can start by lawmakers significantly expanding the supply of affordable housing units and getting rid of exclusionary zoning practices, as well as reconsidering where to build, so that communities in need are being put in harm's way of reoccurring natural disasters, making investments in local partnerships of health systems and community-based organizations to create new affordable housing units, bringing in banks and private sector businesses, and creating buy-in to make it a community effort, partnerships between health-related foundations and community development corporations. Housing alliances and community initiatives are just some of the ideas to address this ongoing issue. More innovation, less infighting. In the next episode, we're going to cover part 2 of affordable housing as we discuss myths that are associated with affordable housing and how new data suggests that COVID-19 is disproportionately widening housing disparities by race and income. If you have anything you want to share, including topics you might want to see explored on this channel, don't forget to leave a comment below. Also, don't forget to subscribe and like this video. I'll see you again in 2 weeks. I'm Will, and it's the People's Hub. Remember, take care of yourselves and each other. Peace.